So I had a patient call me in between that video, so we're going right back to where we were, which was that I was showcasing my beautiful seating area. That's right here. So people come in and they get really weirded out by the fact that they come into this amazing little mini living room and they want to just kind of stand and hover around my desk. And I always tell them, have a seat, sit wherever you're going to sit, and then I'll sit wherever you're not sitting. So it's been really interesting. So, you know, a lot of the, overhead costs for me was really setting up the space, because a physician's office is very sterile. It's very uninviting. It's very scary. It's very anxiety ridden. And so I wanted to make sure and feature things that are very comfortable and warm and cozy, and so that people can feel at home and be themselves. And here is my desk, and I had got a stool, a tattoo stool from Amazon that rolls, and that's been more than enough for me to kind of take back and forth and do OMT on. And this piece of furniture I got from a antique mall, and really has about, let's say, like $70 worth of first aid supplies. I haven't used it once, maybe once. The other thing I have in here is some lube. I have medication that I bought for a potential patient for wart removal. I gave him such a awesome verbal response over the phone about his warts that he didn't even need to get it removed. So that is my reminder to not buy things until you absolutely need it. So this was like $280 for me, and there's 2 files in here, and I am never going to use this probably in my lifetime, but it's here, and it's a lesson, and the lesson is, do not buy anything until you absolutely need to. All this equipment was bought the day of when a patient was coming in for an abscess, and I was thinking of all sorts of crazy things, and I was like, well, just in case it was oozy, or I can like dress it, and I didn't end up using any of it. So don't buy crap you don't need until you need it. Okay, people are very understanding. The other thing I had here is just kind of filing stuff that I've gotten. Filing, like really good filing stuff at estate sales is the best. It's the best to get at, rather than Staples or anywhere else, because I got that little filing thing, and I wish there was more of those for $1 at a estate sale. I had this whole thing filled with books. I didn't use crap. Okay, I didn't use any of it, and so now I've kind of bared down to my most essentials. I've got my OMT stuff. I've got my Goulian, because I just love Dr. Goulian's book that makes me think of different things, and I have an atlas of the human anatomy for my OMT review sometimes I need, and that's pretty much it. It's pretty bare bones. I got this ICD-9 coding book that was absolutely free, because it was expired in some other person's office. Don't buy anything, really, until you absolutely need it. This is my kind of, oh, I don't want to do that. Sorry about that. This is my kind of office area. Got these at, these little things at the Container Store, just for organization. This is a printer that I got for free at LabCorp. Just ask LabCorp. I'm going to use you as my go-to lab. They will give you a color laserjet printer. They will give you free cartridges. It's awesome. The only thing I purchased, which I don't have here, is my scanner. It's a scanner about that long, about $100. It's been super helpful because I can take it back and forth to my house. It's not bulky. I have some of this stuff down here. These are all organizing thingies, but all given to me by LabCorp. All this equipment is given to me by LabCorp. And just to give you an idea, I have about 10 of these urine cups. I've used one in the past 3 months. Gyne, I had to buy some speculums. I've used 3 speculums in about 8 months. So when I'm saying low volume, it's very low volume, and it's a trickle, and that's okay. Music is my key. I have that little guy for kind of setting the mood, so I always have music going here, just kind of relaxing music, so that patients can kind of not hear the drone of outside. And okay, here's all my doctory stuff. I got this, let's see, I don't think that's, I got this thing, which I was thinking of maybe putting for supplies, medical supplies, but I ended up doing office supplies instead. Here's some more. There's my prescription pads. I got prescription pads for like, I think like 5 years worth of prescription pads. I use like one a week. I don't do a lot of prescriptions. That's just not my thing. I talk more about diet. Again, you don't need a lot of stuff. You really don't. I use more Post-its than anything. Wires, empty stuff. So here's some of the doctory stuff. I use this one pretty frequently, so I'll show you. I got a really good ADC laser doohickey thermometer, because I didn't want that plastic stuff, because yeah, if you put the plastic stuff on, it just costs more for trash and all that. I don't want to mess with it, so I got a little bit more expensive thermometer. So this is, I think, infrared, so that's been really handy. Pulse ox. Just got it at, I got this as an intern, and I got it on Amazon. So that is just one battery, works great. Stethoscope, you probably already have that if you're a medical student doctor. Don't need to buy another one. And then blood pressure cuff. I had this like kind of ADC regular blood pressure cuff, but then I ended up actually purchasing one that has the kit that has everything in it, like all different sizes. If I were to open this up, let's see, sorry about this platter, but if I were to open that up, then you can see that I have the small, adult, large, and adult. So that's kind of my only biggest purchase. I got this when I was in med school on eBay, and it was another med student that was selling it. I have not yet replaced it, and that has been more than enough. These little guys, I think I just randomly got one year when I was in internship at a clinic, and I just pocketed them because I wanted to, make sure and know how to do it at home when I was a student, and I'm still using these, so I have yet to purchase them. I got my hammer, some other little tools that I use is just like a free tape measure. This is a bigger one for girth. This one goes with my ophthalmoscope. It goes with my Welch Allyn. The other one that I hardly ever use that I should use more, but free diabetic foot exam thingy. I forgot what it's called. And then light. So this one I got at Home Depot. It's a headlamp. And back to those gyne exams that I do over there, I just put a headlamp on, and I don't have to pay thousands of dollars for stupid speculum light. This is super bright. It's more than enough. And when it's actually really cloudy, it's actually really sunny in here. But when it's cloudy in here, it's nice to put this on and shine this on people's skin or different areas to get a good look at it. And then, of course, I have like the Home Depot pen light, which is awesome. Use that all the time. And that is it as far as medical equipment. You see how much money that is? It's not that much money. You don't need fancy anything. You really don't. To be a general physician, family practice, if you just want to see people and you just want to give them an exam, you don't really need much equipment at all. And as the need arises, that's what I always tell myself, as the need arises, I will purchase what I need to purchase. Some gloves, as you can see, from Walgreens. I didn't even have an account with a medical company at the time. 120 gloves it says on there. I don't know when I'm going to use that. I have some files for office files, like just filing like my medical license stuff, I just put in here. Again, it's from Staples. It's really easy to use. Business paperwork kind of goes over there. And there's some cleaning supply stuff to clean my bed with. When a patient leaves, I usually clean it and sterilize it, and that's more than enough. I use kind of an all-natural multi-surface cleaner. Some paper towels, and some pictures of family so that patients can see that you're a real person and they can be empathetic to, you know, your life, and, you know, just some official doctory stuff and more organizing folders and files. So that is the entire tour of my micropractice, and I hope this gives you inspiration to see how easy it is to set one up, how little overhead you need, and by offhand, half of this stuff in here I already owned, so again, you don't need a lot of stuff. I tend to go a little bit more decoraty and make it look all nice. You don't even have to have that much equipment, really. That's just kind of my own thing. But again, I really hope this gives you enough of an idea of the space so that you can kind of figure out what you'd want to do with your micropractice. So if you have any questions, if you have any comments, I'd love to know what you think. And this is Dr. Strong from Kathmandu Clinic signing off. Thanks for watching.